Before we get started in this episode, a quick announcement. As you know, I'm very passionate about acceptance and commitment therapy, and I also run a busy practice in Canberra. We're currently looking for psychologists who are registered in Australia to join our team, who are also passionate about learning about ACT. We provide supervision on a group and individual basis and training around ACT. So if this is you, if you're interested, please express your interest at strategicpsychology.com.au/careers. Look forward to hearing from you. And now back to this episode.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking. Yeah, better thinking. Time to tune in. Let's go.
Welcome back to Better Thinking. My name is Nesh Nikolic, and today's guest is Dr. Louise Byrne. She is a Vice-Chancellor Senior Research Fellow at RMIT. She previously was awarded the prestigious Fulbright Postdoctoral Scholarship and inaugural RMIT Fulbright Fellowship to conduct research on the lived experience mental health workforce in the United States. She's incredibly passionate in this space, discussing how we can bring lived experience into our workplaces to assist in this better understanding of mental health in the workplace, but also to inform how people with mental health difficulties might be able to access services better. Passionate conversation today. You'll see that Louise oozes this desire and yearning and want to make a difference in this space, which comes from her own lived experience, which I think is a great demonstration of what she's researching as well. So I know you're going to really enjoy this episode. Good morning, Louise, and welcome to the show.
Good morning. Thanks for having me. It's nice to be here.
Look, I wanted to start today's conversation with trying to find out a little bit more about you and this term about lived experience. Well, what does that mean? I know that that's your forte, that's where your experience lies, but I want to hear it from you rather than me make a mess of it.
Sure thing. Well, for me personally, my lived experience has been with using mental health services, both as a teenager and as an adult, including like hospitalizations, involuntary treatments, which often weren't very pleasant, drug use, homelessness, suicide, a whole gamut of things, which understandably really influenced my life, my view of myself, my place in the world. So a lot of those are really stigmatized experiences. And particularly because I started having those experiences as an early teenager in a relatively small town, and some of the experiences I was having were really publicly known. Like a lot of people, I had experiences of being marginalized, of being excluded, of being really heavily judged, and all of the things that come along with those sort of judgments. This was sort of in the early mid-90s. So mental health was still fairly taboo as a topic back then. So I kind of rolled through my life, doing okay, better at some times and worse at other times. And then in my mid to late 20s, I bumped into this idea of lived experience work, specifically peer support roles. Somebody told me about these things called peer support roles. And the peer support person was somebody like me who had these kinds of experiences, these adverse experiences, which had created challenges, which had led to experiences of social isolation or exclusion, which had changed the trajectory of their lives in ways that they probably wouldn't have chosen if they could have, but that had ultimately taught them a lot about self-care, about compassion, about sitting with, your wounds and what happens on the other side of that. What happens when you have sat in your darkness and you've embraced yourself as you are and you're able to, move forward? And it was probably one of the most important days of my life, because immediately I knew that was what I wanted to do. I wanted to be part of that. It made so much sense on so many levels that all of that suffering that I had been through could be turned around and become a gift to someone else. It could become something useful and helpful to someone else. And in doing so, it transforms my experiences somewhat as well, because instead of seeing them as wholly negative or pointless suffering, it becomes purposeful suffering. It becomes something that somebody else can use, to get a leg up and hopefully out of their own, distress. So lived experience work for me obviously is deeply personal. One of the things about lived experience work that people don't always guess, but in a way I feel like they should, but they don't always guess, is that it's incredibly taxing. Because to be good at your job when you're doing lived experience work, you have to go back to some of the most distressing and difficult moments of your life. Given that, you need to have really done some work on dealing with those moments and being okay with them, and finding, I guess, the gold in the shadows. What's the silver lining, or what's the escape route that I found, or what was the learning that I found from this situation? It's the sort of work that, because it's so deeply personal and because it takes you to places that were like very challenging, it leaves you pretty drained a lot of the time. So it's a job that is both incredibly rewarding, and I think it needs to be a vocation. I don't think it's the sort of thing you would do for the pay packet. One, the pay packet's often not all that great, but two, you can't sort of ever really leave your job at work, not in the same way that you could, sort of other things. So it's a great privilege. It's a great honor. And one of the themes from my PhD is that all the lived experience practitioners, workers that I've spoken to also make great sacrifices to do this work. So it's, I think it's a really unique perspective. It's a really unique work style, and not unsurprisingly, it's poorly understood by the rest of the mental health sector and by human resources and by managers, and particularly that cost, that very personal cost that the role has. I think that it's very difficult for somebody outside to comprehend what it takes, the emotional toll that work like this takes. So one of the things, one of the many things that I'm trying to achieve with my research is a better understanding of the work, a better understanding of the uniqueness, the unique features, that ability to empathize at such a deep level with another human being, to go to a place with them that very few other people can go to, and be part of their, journey out of that place as well, be part of the hope and the, I guess, the inspiration to move forward. But it's also about ensuring that people doing this work are getting adequate support, that the organizations and the sectors are taking responsibility for ensuring that these roles are adequately resourced, adequately understood, and adequately supported. Because what we have found is that people like me are so keen to do this work that we often are accepting very substandard conditions, because it's a bit of a roll of the dice position as well. Organizations and the sectors aren't really sure about it. So we'll sort of take what we can get to get a foot in the door, because we know how important this is and we believe in it. But we have a lot of work to do to ensure that the employment sort of circumstances and the industrial relations and all that sort of thing are put in place to allow these roles to be successful and effective, and also to allow the individuals to be, for it to be a reasonable toll on them and not an unreasonable toll, which we are finding in some cases at the moment.
Can you describe or give examples of what some of those roles would be? I mean, you've at least for me clarified that lived experience is really being able to draw on your past, and if you're able to turn that around, it enriches your understanding of not only your life, in some sense gives you a greater purpose or meaning. It can go out and give you a better understanding of others and what they're suffering or pain might be. So it changes potentially how you empathize, maybe even sympathize, and obviously it's a big, long conversation there as well. But can you talk maybe a little bit about what are those roles? How are they different than someone without that lived experience role?
You bet. First of all, I just sort of going back to some of the other, like the points that you've just raised, Brené Brown's work talks a lot about the difference between empathy and sympathy, and empathy being that ability to go there with someone and to get it. And I think the reason that that's so important is because it creates connection. It also creates a sense or a knowing that you're not alone. Because one of the terrible things about mental health and suicide and drug and alcohol addiction and all of these kind of stigmatized adverse experiences, one of the worst things is that despite the fact that so many people have these experiences, nearly all of us, at least early in our journey, still believe we're the only one. We still think we're the loser, we're that exception to the rule who's just not able to cope for whatever reason, and everybody else is doing good or better. And nobody is going to understand this experience that we have. And sometimes people do and sometimes people don't. But that lived experience worker can come down with you into that dark hole and say, hey, you know what? I have been here and I do know what this is about. And you're not alone and you're not the only one. You're not a freak. You're not exceptionally bad. You're not exceptionally weak. You're just a human being who's having a normal human experience. There's ups and downs. This is a down, but it's just part of the tapestry of life. So that ability to normalize the experience, to take it from being something unusually bad, almost like, I almost think it's like sci-fi sometimes still, the way that we think about mental health when people talk about experiences that we label like schizophrenia or, having these extreme, people call them psychotic breaks rather than just experiencing reality differently. It's almost like people are talking about someone from another planet, when in fact, it's just, on a gradient, it's just a more extreme version of the sorts of things we all experience. Like we all think we hear voices occasionally, what was that? Something from the other room. We all sort of see something out of the corner of our eyes. We all experience paranoia. We all experience moments where our perception of a situation was radically different to the way other people perceived that situation. So these are all experiences that everyone has, but unfortunately, we've come to learn to talk and think about mental health, and particularly some of those more stigmatized experiences, as if they are foreign and other, and they sit out there somewhere, and are not part of a normal human experience, which is nonsense. And it's incredibly divisive and it's very, very unhelpful. So lived experience workers bring that been there, done that perspective. They bring the ability to, rather than, one of the big problems that we have with mental health services, people accessing mental health services, is that the expert-patient divide is enormous. You can't really think of a greater gap than a human being who, like myself, has basically failed at life in that moment. Like when I've rocked up to services, I have failed to keep my head above water. I have failed to keep my own mind in check enough to be able to cope with the thoughts that are coming at me. I need another human being to come into my mind with me to help me navigate the mess that I have made. So in terms of powerlessness and feeling useless, I don't think you could, sort of have a more like a down moment on the power kind of spectrum. You're really not feeling like you've got much personal agency by the time you rock up to ask for help with your mental health. So then, of course, on the other side of the counter or the desk or what have you, is someone who's typically quite well dressed, who looks quite sharp, who's got that professional white corporate image going on a lot of the time, and who definitely has a university degree, who is representative of the health system, which of course has an enormous amount of status attached to it. So from the word go, you're just so much on the back foot. There's such a sense of this other person has so much so much more power and clout and status than I do. And then, of course, unfortunately, in mental health services, there's a lot of deliberately robbing people of their personal agency and of their ability to make decisions, particularly when you're hospitalized. There's an enormous amount of needing to just do what you're told, stick to the schedule, be compliant. Compliance, this word that's used so much in mental health services, that's seen as necessary. And then, of course, when somebody comes out the other end, they're discharged from hospital or they finish, their course of sessions or what have you, nobody ever helps you restructure your life so you take the reins back, so that you're back in control of your life. So you go into the mental health system feeling broken and like you don't have the answers, and you come out feeling like other people gave you answers, and ultimately you're still broken. And you might have some band-aids on that, but a lot of the time you still don't have personal agency and you still don't feel able to step up and take control of your life again. So that's a huge missing link. Lived experience workers are a really crucial component in ensuring that that happens, because their focus is always on ensuring that the individual retains some level of control over what's happening to them. And they enhance person-directed, what we call person-directed services, enormously. I don't know if people on your show have talked about the recovery approach, but in Australia and in all the large sort of English-speaking Western nations, the recovery approach has been for decades what we've been moving towards, away from a biomedical interpretation of mental health towards a recovery approach, which is about the individual, not a cure or a cessation of symptoms. It's not about focusing on deficits. It's about the individual finding and reclaiming a life that is meaningful to them, a life with hope. And it may or may not include ongoing challenges with their mental health, but importantly, their life is not defined by their experience of mental health. It's self-defined. And so the lived experience worker, again, has experiences of recovery. They understand that recovery approach intrinsically. And also collectively, the lived experience movement was advocating, championing this idea of recovery for over a century before any mental health services started to pay attention to it. So both individually and collectively, lived experience workers have a deep understanding about how to ensure that an individual accessing services still retains some sense of who they are, and then they build that and they develop that into a more helpful, more useful sense of who they are, and are able to move forward in their life with greater self-concept, a self-concept that is more useful. So I think that's an enormous missing link that the lived experience worker that can uniquely provide. They also provide, we call it a bridge of communication between the person accessing services and the service worker, so the clinician or whomever it is, because they have learnt to work within the mental health service system. They can sort of provide translation between both parties, because there is such a disparate divide between the person accessing services and that health worker. That's another really critical feature of the role that I don't think any other role could fulfill. So to actually get to your main question, and I talk about this stuff a lot, so I'll probably talk for a long time, but there are all sorts of roles. It's very exciting. So lived experience work started primarily peer support roles, we call them, where it's one-on-one support. So you walk with somebody else. I started off in a peer support role many years ago now, and you have the privilege of meeting other humans who are struggling with, whatever their challenge is, and getting to know them. And through a mutually transformational relationship, you talk, you get to know each other, you inspire each other, you find ways. Importantly, that individual finds their own way, and you support them in whatever it is that they identify is meaningful to them and the strategies that they know are going to work for them. So that's the sort of the peer support stuff, which is really that one-on-one or face-to-face support. Peer workers can also run groups, and that happens quite a bit as well. And that could be more like a seated sort of group. Obviously, NA, AA, those kinds of organisations have been around for a long time. They're volunteer organisations where an individual will come, or groups come together to talk about like experiences. These are paid roles. So, and it's very important that they're paid roles to recognise the validity, the important, unique contribution that they make, but also because there's status with paid work that you don't get with voluntary work. So there's the peer support roles, which are similar, but I guess more focused than your sort of volunteer, AA or NA roles. Then we've got a whole gamut of, and we've got roles emerging all the time. So it's very exciting. There's roles in education and training, both within organisations as well as within the higher education sector. There's roles in systemic advocacy. So there are positions in most of the large hospital and health services around the country where people with a lived experience will provide input into the design, the delivery, and the priorities of services. So they're helping at that more like decision-making level, determine how to make the service more relevant for people, basically. It's like McDonald's has always had a big emphasis on what's the customer actually experiencing, what's that customer actually wanting. So it's taking that consumer focus and it's applying it to, a service delivery kind of setting. There's people like me, so I'm a lived experience researcher, and I've been doing that for quite a while now. I used to do some teaching as well. And there are people in consulting roles. There are people who sit on representative boards. There are people in executive governance in a growing number of large NGOs, as well as state funded HHSs across the country. So basically, there's an increasing push for lived experience informed work to be at every level of the sector and every layer of services, so that perspective has the opportunity to be taken up at all levels of service design and delivery, and not just if you happen to be working, one-on-one with, say, a peer support worker. And that's really important. That's an important focus.
I mean, in some sense, you're talking about like that McDonald's approach or any large corporate approach. They're very client focused. They're very client centric. They're trying to understand who are their users and how to best accommodate their needs. And the great challenge there is people come in so many shapes and sizes, and in some sense, there's great complexity in that little example that you provided with attire. If someone is dressed, with like maybe how I am with a shirt, and I have a nice jumper and some pants, some dress, work pants and shoes, it's corporate. And for some people, that will be quite daunting, and it creates that power dynamic and struggle. And for other people, it creates trust and a sense of maybe competence. Everyone reads everything so differently, and it's very, I suppose, complex as to how to inform practice and what that looks like, because there's so many voices. How does lived experience try and talk about those scenarios? I mean, it's probably easy with the black and white sort of attire scenario. How do you because you can just observe it, it's one way or another way. How do we overcome those things, or how do we, table them or ensure that it's not ensure, but try and promote that it's hopefully read the way that services would want it to be read? For example, I don't want my attire to project power or a dominance, or that there's an expert in the room. And at the same time, I definitely want there to be some trust in my competence, which sometimes our dress does say. How do we do that?
Yeah, I think in a way you've sort of already hit on it, because it's about having, like, there are different sorts of people, of course, accessing services. And one of the really important reasons that we need lived experience workers, in addition to all of the other, more established mental health professions that we have, is that there's this demographic of people who are not being catered to, who do find that sort of corporate look intimidating, or need that sort of less formal kind of relationship, who want to talk with someone they feel comfortable with. But of course, there are still people who, as you say, want to go to a more traditional, like, doctor, and they want to feel like this doctor knows what they're on about. And of course, there are also people who want both of those things, or a range of other things. Yeah, and at different times in their journey as well. So one of the things I talk about a lot with the lived experience workforce is it's not a replacement of other forms of, help or support that are out there. It's an additional tool on your tool belt. And just like we can't do without a screwdriver or a hammer or, a pair of pliers, we also need lived experience workers in the multidisciplinary environment that is, service delivery. They're another really valuable way to provide support for people. Apart from the fact that, and saying that, I mean, a lot of peer support work, when I was a peer support worker, I certainly was pretty casual, with the way that I dressed, and I saw that as important. But in my, research roles, and when I was in a systemic advocacy position, I catered more to the tastes of the people around me, as you say, because I wanted to promote an image of credibility. I didn't always feel good about it. It felt uncomfortable, but, different settings, different roles will do different things. But what the lived experience worker provides is an additional perspective. So whether you're talking about corporate, non-corporate, or you're just talking about a variety of perspectives and ways of viewing, the lived experience worker plugs a big hole that we've had for quite a long time, which is truly understanding what the client needs and wants, and how the client views what it is that's happening at the moment. Because for a long time, service delivery was all about what we think should happen. It's that, external perspective. And this allows that mirror to be held up and say, well, actually, no, like, that's working, that's not working. We need to do more of this.
And I suppose in many ways, that's what clinicians are trying, and maybe it's being taught as well, trying to do, is you have to very much be a chameleon. You have to be different with each person. It might be the different language sets. It might be, how you reference things. Obviously your approach. What interests you can tap into that are of like, and so on and so forth. I'll tell you a funny story actually. When I first started, I was still at university, doing work in mental health. I scored a job with Centre Care. They're now called Catholic Care, and the fantastic mob, brilliant organisation. And being very diligent, mum and dad taught me how you're supposed to act and do the right things. And I went into really a environment where there was lots of drugs, alcohol, homelessness, violence, really people who are struggling. And I rocked up after I won my position in a suit, because that's what you do to and I was young as well, so it was just completely off. It was hilarious. And one of the managers there kindly just had a nice, respectful conversation about maybe I could dress down a little bit.
Yeah.
And being so diligent, the next day I came in a singlet, and
One one extreme to the other.
So embarrassing, trying to do it so well. And he ended up saying, well, maybe not that dressed down. And obviously I found a middle ground at some point, but it was so important for me to connect. I needed to make sure I didn't stand out, and both were saying the wrong, message. It wasn't obviously measured at the level, and so I can understand, we might miss it on the attire, but maybe we meet it with the way that we converse with the consumers or the clients or patients, whatever language we use. But even that's important, because even the word patient, I like the word client, but the medical model tends to use the word patient, and that's okay as well. I mean, it's got its roots and so on, but I prefer a client.
For myself, I like person accessing services. There's, people first language, and I guess, that accessing services not the defining feature of this human being. It's a thing I'm doing, at that time. So that's a little bit wordier, but that's what I tend to use. Sometimes I use, in the UK and in New Zealand, they use the term service user. So as a shorthand in writing, nice. I use that term a little bit as well. But yeah, I think it's interesting. That's a good story. I think that in a way, it's sort of, it's the top layer of, like, if you think about this, like, it's like an onion. Like, even if you got your attire right, ultimately still you're walking into a situation where people are having experiences that are just so foreign, probably, I'm assuming, to you, or at least to
100%. Absolutely.
Yeah. So one of the things that I really try to help, clinicians to understand is that although people who are in distress, having challenges of different kinds with adversity, look very disorganized and chaotic in our thinking, we do look like that from the outside a lot of the time. There's a level of perception that I experienced, particularly when I was in distress, and particularly when I was accessing services. It's almost like an authenticity meter. Like, there's a part of you, no matter, like, if you're babbling or whatever is going on, there's a part of you that's really almost at an instinctive level, almost like a primal kind of experience, reaching out to see, is this person being real with me? And I think that's something that I think people do realize that, because people will either, doesn't matter what sort of performance someone puts on for them.
What are you looking for?
Connection, real connection, and lack of judgment. We're looking for the other person to see us as a person, and not as a mess, not as a cluster of symptoms, not as a diagnosis. We want them to see that no matter what our behaviors are like in that moment, we want you to look right inside and see that I'm a person just like you. And maybe today I don't look like you, but I'm as valuable as you are. I'm as deserving of love and connection as you are. And no matter what's happened to me in my life, and no matter what you're on a superficial, societal kind of, matrix, no matter what your status might be compared to mine, I want to see that you don't see there's any difference between us, that you see that I am worth every bit as much as you are, and that you want to know me. You want to see me and get to know me as a person, and that the reason that you're here is because you hope that you might be able to walk beside me in my journey, not tell me what to do, not teach me, not, fix me, but walk beside me and help me find the ways that I can fix things for myself. And again, I think that's what lived experience work is. I know from the research, having lived experience workers in a multidisciplinary environment helps other clinicians to really do that stuff and do it well. And I know that because the clinicians have told me that. It's very exciting that having lived experience workers in their environment taught them to have deeper relationship, better rapport, and to really get past some of the barriers that professionalism can create, to just be with another person. And rather than fixating on an outcome or what it is that they feel that their role is supposed to be, to just spend time with another human being and care about that other human being. And then other things just sort of happen naturally as a result of that connection and that caring.
Let me throw a little bit of a spanner in the works to try and toss this around a little bit. How about the concept of lived experience of being on this earth for long enough that the potential of, if someone has lived for long enough, they must have experienced great, deep loss, more than likely, confusion in their life trajectory, existential questions, value conflicts, great suffering and pain of loss, often, maybe relationship wise, or, the loss of a trajectory of a dream. Maybe not necessarily always at the Maslow's lowest sort of hierarchy, where their needs have pretty well always been met, but their emotional needs have been missed many a time.
Sure.
I think most of us who have lived for any length of time, maybe, and I'm just tossing this around to see where we can go with this. Maybe there's lived experience in that, or how do we look at defining who's able to put their hand up and say, I have lived experience, and where are we kind of going, oh really, you're not quite there. How does that sort of space
I'm very glad you asked. I've just spent 2 whole research projects looking into that very issue. So one thing I think that I'd like to say is we validate, and I validate, everyone has got lived experience. We all, as you say, like if you live to 30, I think you'd be hard pressed to find someone past 30 who hasn't suffered deeply in some way or another. And one of the things that we're hoping for lived experience workforce is actually a higher valuing of all types of lived experience and of everyone's lived experience. So I always think it's a bit of a sort of like a hangover from the patriarchy that we still elevate formal types of knowledge so much, and we don't value that which is learnt emotionally and that which is learnt over the course of life. And I think that's a great shame, because I think the lessons that we learn, internally rather than, from theory and textbook, are often the deepest and the richest. And particularly when you're talking about person-to-person connection, they're often the lessons that really allow for those relationships to be, richer and more rewarding. So one of the goals and one of the realistic outcomes of bringing in lived experience workers is we find that the lived experience of people accessing services is more highly valued. That's, of course, very, very important, because if you come to a service feeling sort of broken and like you're a mess, and somebody turns around and says, hey, you know what, maybe you do feel like that, but we also see that you're the expert on your own particular situation, and that you will have and do have, ideas and, ability to start to shape how things go forward. So rather than feeling helpless, if the people that you go to talk to, the whole service, not just the lived experience workers, but the whole of organization sees that you have a valuable lived experience to bring to your own, recovery, then that in itself is transformational. If all of the, people who identify as having a lived experience in human resource roles, in supervisory roles, in clinician, roles, what have you, if their lived experience is valued, then that decreases the stigma immediately, and it makes the people coming to access the service feel better, about who they are. And again, it's part of the whole of who they are. But you achieve those goals by having the lived experience worker in place, with the ability to specifically focus on shifting that culture, on shifting attitudes, on providing a uniquely different way of viewing, which you don't get taught in psychology or social work or psychiatry or mental health nursing. It's a process that you almost have to go through individually, almost like a de-brainwashing that you have to go through to learn to feel that you have value as a person with a significant lived experience. And I'll go into the difference in a moment. You really have to challenge the thinking that is around us, that kind of taken for granted thinking about people who have adverse experiences. To be helpful to somebody else in their journey, you can't look at yourself in the mirror and think, you're a loser, you know, like you just didn't cope. You can't think, oh, you're not as strong as other people. You can't think you're different than other people in a significant way. You need to do the work internally to look yourself in the eye and think, I'm okay. You know, like I have the right to be here. I have valid opinions. And that's very much, that's a very difficult job to do. That's very much the work of lived experience, because no matter how much sort of, you know, advertising we do around shifting attitudes towards mental health, fundamentally, mental health is still a highly stigmatized experience. And people who have significant mental health experiences and service use and what have you do experience a loss of self-esteem, typically loss of relationship, often, you know, loss of jobs and even homes, loss of status, all these kinds of things. So that the end result of that marginalization, whether it's just you in yourself, like self-stigmatizing, or it's other people around you contributing to that, is that you're left in a place where you don't feel as good as other people, really, to use really simple language. And so part of the work of the lived experience worker is to move from that place to a different place where you see yourself in all your glory, your spots, your good stuff, your strong stuff, your areas where you struggle, and to be able to learn to accept that as a whole person. And in reality, I don't think we're any different than anyone else. Everybody has their, you know, their stronger and their less strong areas, but it's just that we've been taught by the beliefs that we hold collectively as a society that there's something wrong with us. And then you have to learn to not believe that anymore.
It's really interesting because there's almost like a bit of a conflict in that, in talking about lived experience, and that if we kind of try and put on a linear, you know, of anyone who has hardship, you know, and obviously there's greater hardships, there's lesser hardships. And part of the challenge we have is if we describe it, it's very easy for everyone to understand and appreciate what someone's going through. But if we give it a name, a disorder, or even call it like mental health problems, then it becomes a thing.
Yes, it's a problem to do that, to label.
Yeah. And there's almost like a challenge in even by in some sense, and I don't know if I've thought this through enough, but by saying lived experience almost says that there's a category there. You know, and we kind of need to hear from this category. And it's almost like, well, this is the category of the unwell versus this is a position of understanding all. Because in so many ways, what you're describing, I feel, is very much what psychology is always trying to, at least, you know, the way that we do it here, is always trying to sit, you know, in that spot of everyone. I mean, we call often in our sessions that, yeah, our clients are our family members. We want to do everything in the same way that we would for our family members. There's no differences there. That you know, we're all just human beings. You know, the language of being a human being rather than, you know, anything else. But it's fascinating. It's hard to grapple this because we're trying to remove stigma, but we still need to hear a particular voice to have this conversation. So it's, you know, informed by a better understanding of what hardship can look like. and
I,
who
yeah,
can be a good voice for that.
I hear what you're saying. I think I'm glad that we have a long conversation because we have thought about this. So I think one of the things is I don't see lived experience as being defined by hardship or adversity. I see lived experience workers as survivors. They're people who have transformed their
Mm-hmm.
experience into something else, which is not to say that we don't still have, periods of, distress and difficulty, but we've been
Sure.
through it once, and we know that we're likely to get through it again. We have skills. I don't see it as a lived experience of like suffering and distress. I see it as a lived experience of moving through those experiences, of claiming another type of identity, which is not dictated by social ideas, but actually, is something that I have built for myself and that others have, we have built for ourselves, which is about, valuing ourselves as we are with all of those experiences and defying that idea of stigma, really, which is not to say, again, that I don't still face moments where I self-stigmatize. I do, but primarily I have the tools and I have the messages now embedded to push back against that. And importantly, I recognize that I believe that those messages are wrong. I don't fundamentally agree with them. I therefore do not just roll over and sort of go like, oh, yeah, I'm less than. I just say, all right, well, yeah, I hear what you're saying to me, Louise, but I don't agree, and this is why. So I guess the other thing, just going back to your earlier point, is that what we're defining as the expertise needed for lived experience work was talking about having lived experience which is significant enough that it's changed your life as you knew it, that it's just stopped you in your tracks. And instead of going down path A, where you thought you were headed, you've had to totally reevaluate everything you thought you knew about yourself, about your life, about your future, about, your worldview. And you've had to forge, like step by step by step, a very different path than what you were intending. And it's that significant life-changing experience that allows you to really sit with other people who are having experiences that are so significant that their lives are changing.
And how do you feel about even the term like mental health? Because that
Look,
kind
I
of
don't.
does put almost like a partition between, you know, those that are mentally well and those that aren't mentally well. Even these. I like linguistics. I come from I suppose, a mind frame that describing is so much more valuable and helpful and useful, and hence why I like to do this long form conversations rather than categorizing. But our language is just built. I mean, relational frame theory is all about how we what particular language represents. One word can mean can have an infinite number of connections with other things, and therefore can represent many things. And we definitely know that mental health represents stigma. There's something wrong about if you feel anything these days. We just use the word depression, anxiety, just flippantly these days. It's so constant and regular. It's in every household every day almost. It's fascinating how we do this. So how do you feel about mental health? How do we untangle this stuff?
Well, actually leads me to another topic, which I think is really important, particularly in relation to lived experience. I am not a fan of labeling. I was diagnosed with a pretty stigmatized diagnosis at 14. I had a Catholic school in a rural town, and the way that people reacted to that in the
Yeah, that's it. You're
1990s.
done.
It was not
Finished.
helpful. And it wasn't helpful for me because that was later rescinded anyway by some other expert. But in the meantime, from 14, I was like, is that who I am? And I adopted these characteristics and these behaviors because somebody very important and much more knowledgeable than me was telling me that's who I was. So I'm like, really not a fan of diagnosis. Plus, when you were saying, depression before, I think it's so interesting because I say I feel depressed. My neighbor says I feel depressed. The guy down the road says I feel depressed. We all mean different things. What do you feel? I feel down. I feel sluggish. I can't get up. I can't do, like tell me about your actual experience for a start. But then the labeling. This is an interesting one. One, I'd just like to say that I think that one of the really big things that we absolutely have to focus in the lived experience space and the mental health space more broadly is a proactive, really comprehensive attention to how we ensure that diversity and inclusion is meaningfully realized in our workforce. Because we have people from all different experiences, identifications, and cultures accessing services who do not see themselves in the faces and the life experiences of the people that they are talking to. There's still the way that in order for support systems and services to be useful, they need to understand the people who are coming to talk to them. And mental health or suicide or drug and alcohol or homelessness, that's one experience. But if you come from a non-English speaking background, or you come from identifying, as non-binary, or whatever it is that your experience is, if you can't find anybody to speak to who has even a passing understanding of where it is that you come from, then that ability to connect and really walk together is limited, which is not to say that people with different experiences can't come together and different cultures can't come together and assist each other. Of course they can, but we do need to really focus on making sure that there is a better representation of people of color in our workforce, that there are better representation of people with a whole range of adverse experiences and a whole range of identifications. Because again, just having people who represent diverse, experiences tells people accessing services that this is a place that they're welcome. This is a place that they're understood and where their story is going to be meaningfully kind of heard. And that is my way to introduce the fact that the term that I like and I favour is one that's been really championed by First Nations people in Australia, and that's emotional and social well-being. So I think that mental health obviously has so many difficulties, and I would just like to say that I don't think that the mainstream services should just grab that term, social and emotional well-being, and take it, because that is what often tends to happen, particularly with First Nations initiatives. But I think paying due respect to the fact that this concept has been really mapped out specific to First Nations communities, that I think probably the most useful way for us to start looking at mental health going forward and talking about mental health going forward would be to take guidance from First Nations people and communities and the way that they have looked at these issues, and the language that they're using, without stealing it and without, without missing some of the key points, because there's stuff around social emotional wellbeing which is specific to Aboriginal life and Aboriginal communities. But I do think it's probably the only term that I think really gives a sense of, without creating them us kind of barrier.
It almost requires that we keep changing the language, because once we acclimatize to lived experience workers or emotional and social well-being, it's very easy for our head to just categorize that again and just go, I know what that means.
Yeah. You're right. You're so
right.
right. Language needs to be alive.
They're the crazies, right? They're the people, or whatever, nonsense that the mind goes out and does, versus a culture that, someone who doesn't see it that way, they don't care if it's this term or that term or that term. They don't go out and go, they're different to me, they're less than me, I'm superior, they're inferior. It doesn't do that. It just says, I don't care for the term, you're a human being.
Well, just keep talking. And I think that's what you were saying before, is describe it. Don't use a term, just describe what you're talking about.
Yeah, yeah. So maybe in that it doesn't have a term. It's just about how we discuss this, because a term will ultimately, if it's repeated, it begins to represent something.
Yeah. And it picks up, as you say, attitudes.
Yes. You know, like a culture just builds around that term that is adopted by, you know, a larger proportion, then we just kind of get what that is.
Yep. I think that we see that, particularly with, you know, left-wing movements. We see language shifting and changing all the time. And sometimes people talk about that like it's a problem. And I think, well, why is that a problem? Isn't it good to be evolving, always evolving? Like, what's the next thing? What's the next thing? How can we do this in more meaningful ways? You know, how can we consult or, you know, engage with a wider group of people to see how they want to talk about things? One of the things I've always said is, like, you might have like a default term that you use, but whoever, like whatever community you're going into or whatever individual you're yarning with, ask them, well, how do you like to be, you know, how do you like to describe this experience that we're meeting to chat about? Or, you know, what's the sort of term that feels comfortable for you? And then negotiate that. And then it becomes a strength rather than a potential barrier. If you open it up and say, I want to know what this means to you, and I want to talk about this in a way that's meaningful to you, then you've actually, you know, created an opportunity to connect. So I actually think fluidity, you know, with language and evolving language is actually exciting. I know the problem always is, once you've got a big system, you've got a big organization or whatever, and you're trying to do things on a statewide and, you know, a national level, or even, you know, a large regional service, there are times when you need something on a piece of paper that symbolizes the same thing to everyone, so that because you don't have the time to explain it over and over again.
Of course.
So it's that tension between efficiency with a large sort of working model and an individual human being and their real world experience. So I think one of the things that happens, that I see happening, particularly let's say in university systems, we hear the same things over and over and over again, and we start to think that that's like a real thing. Like we buy into it.
Sure.
And I think that reminding people to have a certain level of cynicism about, it's almost like they are just symbols, you know, like the words that we use, the label, it's just a symbol that helps us all have some shorthand idea of what the other person's talking about. But ultimately, we don't really know. So if you're not sure, ask, but also just remember that it's just shorthand. It's not a real thing. Like, don't invest in the idea of mental health or, you know, depression even, or any of those things. That's just a word that we use that, you know, we've got some basic common sense of like what we collectively believe that means. But when it comes to the nuts and bolts of it, we need to have a proper conversation about what that means to you and what that means to me.
Because it almost feels like once we categorize, which, as you mentioned, kind of has to happen, because how else do you go out and communicate to the masses? But once we grab those, we start placing meaning and representation around what those things are, and then we start feeling insulted, and people start saying, I don't feel safe in this area, you know, and these are the things that I need to be to feel safe, but they're not an individual conversation. It's a mass communication, and vice versa. You know, I mean, every session that I've ever started, you know, in therapy is, you know, we go through confidentiality and all that sort of stuff, and then I just say, so what brings you here? And unfortunately, so much of the time, what I hear is, well, I've got, which is the identification. You know, they don't say I've got the flu, but they will say I've got depression or I've got, you know, anxiety. You know, it's something interesting. And, you know, obviously my job is to say, you know, can you tell me a little bit more about that? Describe what that means to you, what that, you know, is like for you, what's it like to be in your skin, et cetera, et cetera. You know, I'm trying to unpack it and understand it, which is probably where clients go, I think I'm being heard and understood, but I will generally still try to communicate that with others in a shorthand because I don't have an hour and a half to write a letter to someone else about this. So it's complex. It's a real, I think you use a nice word, like there's tension between trying to achieve both functional and merit-based outcomes.
Yep, absolutely. I think the other thing that you remind me of is which I still hear a lot, is people saying, oh, so-and-so is bipolar, or I am, whatever.
Crazy.
And it's just like, wow, but that's, sort of, I guess what I was talking about before with that lived experience role of moving through layers of nonsense that we've constructed around these kinds of experiences. That's one of the layers of nonsense that we have to move through, is that idea that you are defined by kind of these experiences. And absolutely, I know that a lot of the clinical workforce is also sort of trying to achieve the same thing. And I think I guess going back to your earlier question, it's about how you do that. So a lived experience worker can say, hey, you know what? I know what it feels like to get a diagnosis. I know what it feels like when people see me as if that's who I am. And I'll tell you what, that's not who I am. And
Yes.
I also know how to let that go and move into a place where I recognize, and other people increasingly recognize, that that's not who I am. So I guess it's always with the lived experience worker, it's always shades of difference. And anyone who's coming from a recovery informed perspective, and anybody who's coming from a person, person to person perspective, we're all trying to achieve the same things in our various roles, but it's the tools that we have to do that. And it's the how do we do that? So all of the different disciplines have different, sort of underpinning theories or practices which are common. And the lived experience stuff, which is so unique, is that ability to just say, yeah, me too. I've been there. And then sometimes you want to share excerpts from your personal story. Sometimes it's not even needed or useful, but it's that establishing that you too know what something like, not the exact same, nobody's having the exact same experience, but you've had an experience which is comparable in some ways, and you can relate to it, and you can empathize, and you together can think about what, from a practical, common sense, lived perspective, we can do together, and I can do myself as the person accessing services to make changes that are meaningful to me.
I'm sure this is going to generate a lot of people who are going to want to know more about this and look at the research to find out how lived experience unfolds and its contributions and value to society, how we structure it, how we're informed by it. Where can people go to find out more about this? I know you've done we've done lots of research in this. Can you talk about where we could go to follow up on this and continue to have that conversation?
Absolutely. So there's a range of places. Like if you're somehow connected with academia, like most researchers, I've got a ResearchGate profile. So all of my work is up there. I recently, with my team, led the writing of the National Lived Experience Workforce Development Guidelines, and they will be released sometime this year. So that's probably more for organizations who want a blueprint. And I mean, man, this is exhaustive. We exhausted ourselves creating this document, but it's really the A to Z of what you need to do, to create a good lived experience workforce. But the other place that I'm really excited about sharing today is one of my frustrations working in research is that it's not as freely available as it should be. I think all research should be free and that everyone should be able to access it. But even if it is, a lot of the writing is so dense and incomprehensible that even if you've got really high, standards of literacy, it's still difficult and or boring. I'll tell you what, I am not a big fan of academic writing myself. So some colleagues that I work with frequently and myself have taken all of the key pieces of work that I and we have done on lived experience workforce, and we've created a website called Lived Experience Leadership leadership.com.au, lived-experience-leadership.com.au, and we've got a range of just like handy like snapshot definitions. So that stuff I was talking about before, what is the lived experience required? What is lived experience workforce? What are the skill set, of a lived experience worker, that kind of thing. And we've kept it all really snappy. And then there's downloadable PDFs, if you want to take it and show somebody else. We've also got really plain language summaries of the articles. They're not all up there. It's this is a soft launch. It's a work in progress, but there's a number of articles already up there. And so there's a link to the full article for those who really want to get into that side of things. But there's also a 1 to 2 pager, which just gives you the guts of it. What are the main findings? And if I wanted to think about, or I've got lived experience people working in my organization and I need to know a little bit more about X, here are the main things that the research has found. So you don't have to, you can spend 5 minutes instead of, 2 hours reading an article.
And is this just the research that you guys have put out, or is this more of a collection? Because obviously some of the issues that I have with finding research is I can go through and read research. I'm fairly literate in that sense. Having said that, the minute I get to any of the statistical analyses, I don't know if they've been peer reviewed, whether they actually stand up in court, so to speak, because as we know, not all research is good research. Who's vetting that and putting them up? Is it just your group, or is it a wider sort of global collection?
It's peer-reviewed work. So it's articles that there's a couple of pieces. So we did the Queensland Lived Experience Workforce Framework a couple of years ago, and the national guidelines. We've got summaries, or we will have summaries of those up once the national guidelines is available. But they're not peer-reviewed, but they're evidence-informed. So we used all our peer-reviewed work to write those documents.
Sure.
Everything else up there absolutely is published peer-reviewed work, incredible, journals. And then what we do is we take that and we turn it into 1 to 2 page summary so that people can just have that nice little,
brilliant.
The other thing we've got, so my work and this piece of work is the most substantial, I guess, research program into lived experience workforce in this country, definitely. So we sort of felt justified in, that's our emphasis, because there's quite a lot of work. I've been pretty much exclusively focusing on lived experience workforce development for 12 years. And I had a Fulbright and I went to the US and, worked over there and done studies internationally and all that kind of thing. So it's a pretty meaty set of findings together. But we also have got some featured work, some work by other Australian lived experience researchers. It's not exhaustive, but just some really key pieces, really seminal pieces. And similarly, internationally, we've just got a small range. What we're aiming to do more and more is also have links to repositories, so spaces where people can go. And one of the things that's really difficult when you're talking about credibility, I think about credibility, there's 2 things I want from credibility. I want the work to be credible from a research perspective, so peer-reviewed in something, credible journal and all the rest of it. But I also want it to be credible from a lived experience perspective, because as this workforce is gaining popularity, what we're finding is that there are people popping up all over the place with an interest in it, but not necessarily a deep knowledge of it. So there's more and more work going into other people studying the lived experience workforce that's not necessarily lived experience informed or led, and that's problematic. So one of the things that this website does is focuses on lived experience led work, and these are credible concepts. So the work that that I've done and that my team has done within Queensland and nationally, literally more than 1,000 people gave us feedback on the documents that we put out across the nation, across the sector, across role types. So first of all, we've done the research, we'd had that published, then we sort of collated it all together into these pieces of work, and then we had engagement after engagement after engagement to ensure that it hit the mark with the industry. So it's been really thoroughly vetted, and of course it all comes from a lived experience led perspective, which I think is really important increasingly going forward, because we're actually seeing more and more people sort of popping up and claiming to lead lived experience kind of spaces who often have no experience. They don't themselves have a lived experience. They're not connected to the movement and they don't understand the underpinning. So we definitely need spaces where people can trust that what is being put up is representative of this, this collective thinking and this movement. The other thing I would say is we've also got some stuff. So I did a TEDx a few years ago, which is like 20 minutes in which I talk about lived experience work, like sort of from a personal and professional point of view, and people can have a look at that. And there's a few other video and audio resources. So we're sort of trying to make it
Is that all in the same
space.
place? Is
It's
that
all
all
in
in
the same place.
what's the because what an incredible and free resource. What is the website, or how do you go? How do you find all of that material?
If you type in livedexperienceleadership.com.au,
Oh,
then
it's
you will
that one.
find
Okay.
us. Yeah.
Brilliant.
So
Brilliant.
all of that. So yeah. So effectively, we tried to make it a place where anyone who's interested in learning about lived experience work, whether you're an individual accessing services or you're an executive director, if you're a researcher, it doesn't matter. There's stuff there for you. So you can access the full peer-reviewed articles. You can just download the 1 to 2 page summary of the research. You can get the plain language summaries of the definitions of the work. You can watch a video. You can listen to a radio. We'll put your podcast up there at some point. So, there's all these different ways to engage with it and find out more.
No, fantastic. Look, I'll have to pass on those details. We have an organisation here in the ACT called ACT Mental Health Consumer Network, and they do exactly that in terms of try and be a voice for what they use the word consumer for service consumers, mental health service consumers around Canberra, to whether it's the hospitals, whether it's mental health ACT, the various sort of place, and they've got advocates that go out and sit in meetings and the like. So a fantastic group, and they really do inform lots of things, including really important policy decisions about, how people are cared for. I know personally, they've specifically put a lot of work into what's it called when your rights are taken away from you, and professionals decide for you as to what treatment you're going to get.
Involuntary treatment.
Yeah, there's a particular term, but yeah, in terms of how to try and not only have policy, but also to teach people on the ground about that as well. Because it's one thing to have policy; it's another thing as well to then have implementation of that policy. So there's many. I think it's called a health directive, or mental health directive or something. Maybe here in the ACT.
An advanced directive, like when
that's probably it. It's I don't know. I there's too many terms, but these terms should be well known and spoken about. So they do represent something extremely important, and here I am just forgetting those as well. But I'll be passing on those details to the network, because that's the sort of stuff that they can potentially just pick up off the shelf and use themselves to distribute, because you guys have done all the work. So it's amazing.
All of the research that I've done has been very much about creating advocacy tools for our workforce. So that's exactly the intention, is that people can pick something up, and instead of having to troll through, all sorts of things, they can put it on their manager's desk, or they can take it and say, look, evidence shows us this. And it strengthens, like, it's great to have people, and I have heard of the ACT Consumer Network, and there's many organizations like that across Australia, peak bodies representing consumers and carers, and they do fantastic work, and there are skilled people making arguments and advocating for people accessing services all over the place. And what this work does is adds another layer to that argument, so that, like, I can say, this is what we've seen, anecdotally, and then they can point to the research, and the research says, yes, we're right, so it's just We work in an evidence-based system, and so really this work just allows people to add credibility to what it is that they're trying to do in the lived experience space.
Fantastic. What's next for you? What research are you doing at the moment?
I actually don't know. Like I'm for the first time, I'm in between projects right now. For the first time in like 7 years, I've had overlapping. We just finished the national guidelines. Well, not just finished, but yeah, I actually don't know. I'm very excited. As a result of the Royal Commission into Mental Health Services in Victoria, there are some incredible opportunities coming up for the lived experience movement. They've really committed funds and proper positions. And I think that there's opportunity to see lived experience much more meaningfully rolled out than it ever has been before. So mostly I'm writing papers at the moment because I've been doing so many, research projects. There's a lot of data sitting there that needs to be written up, and kind of waiting a little bit to see. I'm always looking for what do I think will be the next most impactful thing that I can do to contribute. So yeah, just sort of kind of work out what that is.
Yeah, you got to wait and let that germinate and find the opportunity rather than whatever's just sitting there. You got to be selective.
Yeah,
Louise, I could talk to you for another hour and a quarter, an hour and a half, quite easily. Thank you very much for your time. I know that you're busy and you've taken time out of your schedule to talk to us and give us your incredible insights. Thanks for the awesome work that you're doing, and I'll be sure to pass on those details. And look, we'll put a link as well, on our website. Anything else that you want to add, please let us know. We'll connect it from our website to wherever you want to send us, and we'll go from there. So thanks very much, Louise. Really appreciate it.
Thank you. I had a ball. It was a great treat for me to be able to talk so much about these things that I care about so much. And it was lovely speaking with you. Thanks.
If you enjoyed this podcast, please support it by going to iTunes and putting a review, subscribe, share it via social media, and tell others about it. Start a conversation. It's listeners like you that make this able and possible, and why we bring in these guests to go out and share their knowledge and resources. And just lastly, if you are a psychologist and you want to go out and be part of a bigger team, develop your experience and get into some exciting work, come to strategicpsychology.com.au/careers and reach out. I'd love to hear from you.